Thanks for being here for Good Day Stateline. Early and consistent care is important for expectant mothers and their babies. I'd like to introduce you to a couple of women who can help them get the care they need. Welcome, ladies.
Thank you.
Thank you so much for being here. We have Patricia Monaghan and Dr. Karen Liao.
Yes.
And you are from the UI Health LP Johnson Family Health Center.
That's right.
That is a long place, but thankfully I had it written down so I didn't mess it up. So Dr. Liao, tell us a little bit about the LP Johnson Family Health Center.
Yes, so the LP Johnson Family Health Center is a really unique family medicine practice. We have been here serving the Rockford community for many, many years. What makes us so unique is that not only do we provide a wide range of healthcare needs for all ages and phases of life, we are also a teaching facility that helps resident physicians who specialize in family medicine to become future family doctors.
Oh wow, so when you say all ages and phases of life, what exactly do you mean by that?
So as family doctors, we are trained in obstetrics, pediatrics, adult medicine, behavior medicine, as well as geriatric. So
the whole
thing. That's a lot.
Yes.
So in our clinic, we are able to provide the newborn care. For the pediatric population, we provide well child checks, sports physical, immunizations. For adult and elderly populations, we provide annual physical, well woman checks, and any acute and chronic illnesses management, and we also provide prenatal cares.
So we were talking about prenatal services, and that's why you're here, Patricia, right?
Yes.
Can you tell us all about the prenatal services that you offer?
Yeah, absolutely. So at the LP Johnson Family Health Center, we care for a lot of pregnant women, from it's their first pregnancy to their sixth pregnancy and so on. We pride ourselves in providing them with quality patient care, but also one-on-one personal attention. So when you find out you're pregnant, it's sometimes exciting and scary, and other times it's a little bit of both. So we want to help you through that process. So when you find out you're pregnant, you would get set up with someone like me, who's an OB care coordinator, that would do a brief history with you, give you some education, answer questions. You'd have some labs done for that first appointment, and then you would be scheduled for an initial ultrasound, which is the first look at baby. You get that excitement of seeing the growing baby. You'll be assigned an official due date, as well as then be able to start planning your future with this new baby. Once you've had both of those appointments with the OB care coordinator and your dating ultrasound, then you'd be linked with one of our many providers that provide prenatal care.
That's quite a lot that you are helping with.
Yes, absolutely. They get assigned to me to be their one-on-one person as their support person to complement what the physicians are doing.
Which is very necessary. I don't have any kids, but I have plenty of people in my life who have kids, and I know that all of the pieces of having kids are stressful, can be stressful.
Yes,
I'm guessing,
absolutely.
Especially like first-time moms, especially, you know, there's no list, but you actually have the list of how to prepare.
Right, absolutely. I have 6 children, and I can tell you every pregnancy was so different, and you have so many questions, whether it's your first or your sixth, that you just need that extra support.
So not only are you qualified medically, you're qualified momly to be helping out. That's great, Patricia. Yes. Dr. Liao, what do you think is the most important thing that patients should know about the Family Health Center?
The most important thing patients should know about our facility is that we are very proud that we're able to provide continuity of care. And what that means is that not only do we see our own patients in clinic, we also provide patient care in hospital settings. Let's take prenatal care for example. If one of my patients become pregnant, I will provide the prenatal care throughout her pregnancy. I will personally deliver her baby and take care of the mother and the baby throughout her hospital stay. After discharge, I will see the mom and the baby in my own practice and continue to provide care for them every step of the way. I will say most of the family doctors now are gradually giving up their hospital privilege, but it's really our honor that in UI Health LP Johnson Family Health Center, we are still keeping the tradition to provide continuity care for our patients. And because of that, our physicians, they really know their patients, and we're able to create this really strong bond and trust and the partnership with our patients.
Absolutely, because they just keep coming back to you and
That's right.
might be more open to ask the questions that they have or something like that because
That's
they're
right.
comfortable with you. So that is what you think makes your practice unique, or are there other things that make you unique as well?
I think, as I mentioned earlier, we're also a teaching facility.
Right.
Yeah, so we help to guide the resident physicians who chose to become family doctor to make their wishes come true. So in our clinic, they are providers who are UIC, the residency program. They are licensed doctors who work with the attending physicians to kind of help them taking care of their patients' panel. So this residency program has been here and established for about 50 years. They have created so many amazing family doctors who are now in all these major medical facilities around Rockford area as well as the nearby towns. And myself also graduating from the medical residency program.
We do have a great medical community in Rockford.
That's
there are
right.
a lot of great places, and obviously this is one of them if you are having a baby or one of the many other things that you guys do over at your center. So what's the best way to ensure a pregnancy is healthy and the baby is having early and consistent prenatal care?
I think the most important thing is the patient should, if you are trying to become pregnant or you're already pregnant, it's very important to let us know early so we could start helping you to maintain healthy, resulting in a healthy baby.
Awesome. Well, thank you guys so much for coming. Gina Weber is back from the Body Workshop to tell you all about this new class she has coming up. Roll and release.